A pharmacist at a busy hospital has been noticing an increase in medication errors during shift changes. Which strategies should the pharmacist implement to minimize medication errors, and what regulations or guidelines govern the implementation of such safety protocols? Answer: to minimize medication errors, especially during shift changes, the pharmacist should implement standardized handoff procedures, standardized communication tools, GSBAR, situation background assessment recommendation, help ensure that all necessary information about ongoing treatments is passed on without omissions. Automated systems for double-checking orders, utilizing electronic health records and barcoding systems can reduce human errors by ensuring the correct medication, dose, and patient. Training and competency assessments. Staff should receive ongoing training on the use of technology like HR and medication dispensing systems and on protocols for preventing errors, regulations, and guidelines. Joint Commission's National Patient Safety Goals. These goals emphasize the importance of accurate patient identification and medication reconciliation to prevent errors. Institute for Safe Medication Practices ISMP guidelines. ISMP provides detailed recommendations on communication, labeling, and error prevention. Dr. Smith is opening a telepharmacy service in a rural area where access to pharmacies is limited. What steps should Dr. Smith take to comply with privacy laws when providing telepharmacy services, and what technology considerations are essential for ensuring secure patient verification? Answer: to comply with privacy laws and ensure secure telepharmacy services, Dr. Smith should adhere to HIPAA regulations. The Health Insurance Portability and Accountability Act (HIPAA) requires that all patient information handled via telepharmacy be protected. This means using encrypted communication platforms for video consultations, secure electronic prescriptions, and maintaining confidentiality during virtual patient interactions. Use multi-factor authentication. To ensure the identity of the patient, telepharmacies should require multi-factor authentication, which could include something the patient knows, password, something they have, ID verification, and biometric data, fingerprint or facial recognition, technology platforms for secure dispensing. Dr. Smith must use systems that meet legal standards for electronic prescribing and that include fail-safes like automated patient verification before dispensing. Legal considerations. State-specific telepharmacy licensing. Many states have specific telepharmacy regulations that require separate licensing for remote dispensing services. Dr. Smith must ensure that his service complies with state licensing requirements. HIPAA security rule. This requires implementing technical safeguards to protect electronic patient health information (FI) and ensure the confidentiality, integrity, and security of patient data during telepharmacy services. What are the key documentation and record-keeping requirements for pharmacies to maintain compliance with the DEA regarding controlled substances, and what consequences might arise from non-compliance? Answer: pharmacies must adhere to strict DEA requirements for controlled substances, which include inventory records. A biennial inventory must be conducted of all controlled substances, ensuring the records reflect the quantity of each Schedule II, IV, and V drug on hand. Dispensing records. All controlled substance prescriptions must be recorded, including the drug name, dosage, patient information, prescribing physician, and date of dispensing. Disposal and destruction records. When disposing of controlled substances, e.g. expired or unused drugs, pharmacies must use deauthorized methods and document the process thoroughly. Consequences of non-compliance. Non-compliance with these regulations can lead to severe penalties, including DEA fines or sanctions, financial penalties, and potential suspension of DEA registration. Criminal charges. Intentional mismanagement or diversion of controlled substances may lead to criminal prosecution. How does pharmacogenomics influence personalized medicine, and what are the legal and ethical considerations pharmacists must adhere to when utilizing pharmacogenomic data in patient care? Answer: pharmacogenomics tailors drug therapies based on a patient's genetic makeup, leading to more personalized and effective treatments. For example, genetic testing may reveal that a patient metabolizes a drug too quickly, requiring a dose adjustment to achieve therapeutic levels. Legal and ethical considerations. Informed consent. Pharmacists must ensure patients understand the implications of genetic testing and give consent for its use. Patient privacy (HIPAA). Genetic information is highly sensitive, and pharmacists must comply with HIPAA when handling and storing this data. Genetic test results should only be accessible to authorized healthcare providers. Non-discrimination. Under the Genetic Information Non-Discrimination Act, GINA, pharmacists must ensure that genetic data is not used to discriminate against patients in employment or health insurance settings. Mr. Taylor's pharmacy recently underwent a DEA inspection, and several deficiencies were identified, including improper record keeping for Schedule I drugs. What steps should Mr. Taylor take to rectify these deficiencies, and what actions can the DEA take if the issues are not addressed promptly? Answer: Mr. Taylor should immediately implement corrective actions. This involves updating the pharmacy's record-keeping system to ensure it complies with DEA requirements. The detailed review of dispensing logs, inventory counts, and destruction records for Schedule I drugs should be conducted. Staff training: Mr. Taylor must ensure that all pharmacy staff are trained on proper documentation and handling procedures for controlled substances to avoid future deficiencies. Respond to the DEA. A written corrective action plan should be submitted to the DEA outlining the steps taken to rectify the issues and prevent future occurrences. DEA actions for non-compliance: if the deficiencies are not corrected, the DEA can impose civil penalties, fines for non-compliance, suspension or revocation of DEA registration. Without DEA registration, the pharmacy cannot legally dispense controlled substances. What are some common red flags that may indicate fraud, waste, or abuse for a pharmacy, and what strategies can be employed to prevent such occurrences? Answer: common red flags for FWA in a pharmacy include unusual prescribing patterns. Frequent prescriptions for controlled substances by a single prescriber may indicate drug diversion or abuse. Excessive refill requests. Patients requesting early refills or multiple prescriptions for the same drug could be signs of abuse or fraud. Billing irregularities. Pharmacies submitting claims for services not rendered or medications not dispensed. Prevention strategies. Auditing and monitoring. Regular internal audits of prescriptions and billing records can help detect and prevent FWA. Prescription monitoring programs, PMPS. These state-run databases allow pharmacies to track patient prescription histories and identify potential abuse or fraud. Relevant laws. The False Claims Act and Medicare Part D regulations mandate that pharmacies take steps to prevent FWA, including maintaining accurate records and participating in audits. During a routine audit, a pharmacy is found to have incomplete records for controlled substances. What specific actions should the pharmacy take to ensure compliance with regulatory standards, and what are the potential repercussions of failing to maintain accurate records? Answer: to ensure compliance with regulatory standards after an audit reveals incomplete records, the pharmacy should take the following actions. Complete record review. Conduct a comprehensive review of all records related to controlled substances, including prescription logs, inventory records, and disposal records. Identify any missing or inaccurate entries. Implement a record-keeping system. Establish a robust electronic or manual system for tracking controlled substances, ensuring that all transactions are logged accurately and timely. This includes automated inventory management systems that alert staff to discrepancies. Staff training. Provide ongoing training for all pharmacy personnel on the importance of accurate record-keeping, focusing on regulations pertaining to controlled substances. Training should cover procedures for logging, correcting, and disposing of records. Create corrective action plans. If deficiencies are identified, develop a detailed corrective action plan that outlines how the pharmacy intends to rectify the issues, including timelines and responsibilities. Potential repercussions for non-compliance. Administrative fines. The pharmacy may face civil penalties or fines imposed by the DEA or state regulatory agencies. Loss of licensure. Continued non-compliance may result in the suspension or revocation of the pharmacy's license to operate, affecting its ability to dispense medications. Legal consequences. Failing to maintain accurate records can lead to legal repercussions, including investigations for potential drug diversion or abuse. Relevant regulations. The Controlled Substances Act (CSA) mandates precise record keeping for controlled substances to prevent misuse and ensure accountability. What key legal and regulatory challenges does a pharmacy face when implementing a telepharmacy service, and how can these challenges be effectively addressed? Answer: when implementing a telepharmacy service, pharmacies encounter several legal and regulatory challenges. Licensing requirements. Telepharmacies must comply with state licensing regulations that govern the operation of remote pharmacies. This may include obtaining a separate telepharmacy license and ensuring that all pharmacists involved are licensed in the state where services are provided. Patient privacy and HIPAA compliance. Telepharmacies must ensure that all patient interactions and data are protected in accordance with HIPAA regulations. This includes using secure video conferencing tools and safeguarding electronic health records, controlled substances regulations. The prescribing and dispensing of controlled substances via telepharmacy can be complex. Pharmacists must ensure compliance with both federal and state laws, which may require in-person evaluations before certain medications can be prescribed. Effective strategies to address challenges: establish standard operating procedures (SOPs), develop clear SOPs that outline the protocols for patient interactions, prescription processes, and data security measures to ensure compliance with regulations. Training and education: provide comprehensive training for pharmacists and staff on the legal aspects of telepharmacy, including state-specific regulations and compliance requirements. Consult legal experts. Work with legal professionals who specialize in pharmacy law to ensure all aspects of the telepharmacy operation meet current legal standards, relevant laws, and guidelines. The Drug Enforcement Administration (D) provides guidelines for telemedicine and controlled substance prescriptions, which must be adhered to in telepharmacy practice. How does the FDA regulate pharmacogenomic testing, and what implications do these regulations have for pharmacists when counseling patients on pharmacogenomic therapies? Answer: the FDA plays a crucial role in regulating pharmacogenomic testing by overseeing the approval of tests that are used to assess genetic factors affecting drug metabolism and efficacy. Key aspects of FDA regulation include approval of genetic tests. The FDA evaluates and approves pharmacogenomic tests based on their safety and effectiveness. Tests that are considered high risk may undergo more stringent review processes. Labeling requirements: FDA-approved medications may include specific pharmacogenomic information in their labeling, indicating how genetic factors can influence drug response. Pharmacists must be familiar with these labels to provide accurate counseling. Monitoring post-market data: the FDA continues to monitor the performance of pharmacogenomic tests and related therapies through post-market surveillance to ensure ongoing safety and efficacy. Implications for pharmacists: informed patient counseling. Pharmacists must be knowledgeable about how genetic variations can affect drug therapy, enabling them to counsel patients on the significance of pharmacogenomic testing results and how these results influence medication choices. Collaboration with healthcare providers. Pharmacists should work closely with physicians and genetic counselors to interpret pharmacogenomic data accurately and to make appropriate recommendations for personalized therapy. Staying informed. Given the rapid advancements in pharmacogenomics, pharmacists must stay updated on FDA regulations and emerging evidence related to pharmacogenomic testing to ensure they provide the most current advice to patients. Relevant regulations. The FDA's regulatory framework for genetic testing includes guidelines on the development and use of pharmacogenomic tests in clinical practice, emphasizing the importance of accurate labeling and patient safety. What are the essential components of a standard operating procedure (SOP) for preventing fraud, waste, and abuse in pharmacy practice, and how can these SOPs be effectively implemented and enforced? Answer: a robust SOP for preventing FWA should include the following essential components: clear definitions and guidelines. The SOP should define what constitutes fraud, waste, and abuse, providing examples relevant to pharmacy practice. This clarity helps staff understand the behaviors to watch for. Training programs. Implement regular training sessions for all employees on FWA prevention, covering the legal implications of FWA and the pharmacy's specific policies. Training should be documented and updated regularly. Reporting mechanisms. Establish confidential reporting systems, e.g. hotlines or online portals, that encourage employees to report suspected FWA without fear of retaliation. Auditing and monitoring. Regular audits of billing practices, prescription patterns, and employee activities should be conducted to identify potential FWA. These audits should be random and scheduled to maintain the integrity of the process. Corrective actions. The SOP should outline specific steps to take when FWA is suspected, including investigations, disciplinary actions, and corrective measures to prevent future occurrences. Effective implementation and enforcement. Leadership commitment. Pharmacy leadership must demonstrate a commitment to FWA prevention by actively supporting SOPs and encouraging a culture of compliance. Regular review and updates. SOPs should be reviewed and updated regularly to reflect changes in regulations, technology, and pharmacy practices. Staff should be involved in this process to ensure the SOPs are practical and comprehensive. Performance metrics. Implement metrics to assess the effectiveness of the SOPs in reducing FWA incidents using data to drive continuous improvement. Relevant guidelines. The Office of Inspector General (OIG) provides guidance on establishing compliance programs in healthcare settings, emphasizing the importance of preventing fraud, waste, and abuse in pharmacy operations. A new pharmacy is preparing to open, and the owner is in the process of applying for a DEA registration. What are the key requirements for a pharmacy to obtain DEA registration, and how does this process ensure the proper handling of controlled substances? Answer: to obtain DEA registration, a pharmacy must submit DEA Form 224, which is required for any entity that intends to dispense controlled substances. The pharmacy must meet several key requirements. Verification of legitimacy. The pharmacy must be a legally recognized entity, typically licensed by the State Board of Pharmacy, before applying for DEA registration. Compliance with security requirements. The pharmacy must demonstrate that it has the necessary storage and security measures in place for controlled substances, e.g., secure locks, restricted access areas, record keeping. Pharmacies must maintain accurate records of all controlled substances received, dispensed, and disposed of in accordance with DEA regulations 21 CFRSS. Separate records are required for Schedule II substances, while Schedules V substances may be stored with non-controlled substances provided they are easily retrievable. Background checks. The DEA may conduct background checks on pharmacy employees, especially those who will handle controlled substances, to prevent diversion or misuse. Renewal of registration. DEA registration must be renewed every 3 years using DEA Form 224. Dr. Carter, a pharmacist, is approached by a patient, Mr. Anderson, who presents a prescription for an opioid pain medication. After reviewing Mr. Anderson's profile, Dr. Carter notices that he has filled similar prescriptions from 3 different doctors in the last 2 weeks. Dr. Carter is concerned that Mr. Anderson may be misusing the medication. What should Dr. Carter do in this situation, considering his ethical and legal obligations as a pharmacist? Answer: Dr. Carter faces both ethical and legal responsibilities in this situation. Patient safety, non-maleficence. Dr. Carter has an ethical obligation to prevent harm to Mr. Anderson by ensuring that he is not at risk of opioid misuse or overdose. He must act in the best interest of the patient's health and safety. Due diligence, legal responsibility. Dr. Carter should verify the legitimacy of the prescription by contacting the prescribers and cross-referencing prescription records. This aligns with DEA regulations, which require pharmacies to ensure that prescriptions for controlled substances are issued for a legitimate medical purpose. Potential red flags. Multiple prescriptions from different providers within a short period can be a red flag for doctor shopping, a practice used to obtain multiple prescriptions for controlled substances. Confidentiality, HIPAA. Dr. Carter must maintain patient confidentiality throughout the investigation, ensuring that only authorized personnel are informed of the findings. Appropriate action. If Dr. Carter confirms that Mr. Anderson is engaging in improper behavior, he can refuse to fill the prescription, document the refusal, and report the issue to the DEA if necessary. What is the process for verifying a DEA number for a prescriber, and why is this important for pharmacies dispensing controlled substances? Answer: DEA numbers are unique identifiers assigned to healthcare providers authorized to prescribe controlled substances. The verification of a DEA number is crucial for ensuring that prescriptions for controlled substances are legitimate. The process for verifying a DEA number includes the following steps. Formula for DEA number validation. The first 2 characters are a letter followed by the prescriber's first initial. The following 7 digits are calculated using a formula to verify authenticity. Sum the first, third, and 5th digits. Sum the second, 4th, and 6th digits and multiply this sum by 2. Add the 2 sums together. The last digit of this sum should match the 7th digit of the DEA number. Importance of verification. Verifying a DEA number ensures that the prescriber is authorized to issue prescriptions for controlled substances, thereby preventing diversion and abuse. Pharmacies must also ensure that the DEA registration is current and that the prescriber has the correct scheduling authority for the prescribed medication. Failure to verify a DEA number may lead to the unlawful dispensing of controlled substances, a violation of the CSA, which can result in severe penalties for the pharmacy, including fines and the revocation of DEA registration. How does HIPAA apply to the operations of a pharmacy, particularly in terms of electronic and paper records, and what are the penalties for non-compliance? Answer: HIPAA, Health Insurance Portability and Accountability Act, establishes national standards to protect sensitive patient health information from being disclosed without the patient's consent or knowledge. In pharmacy practice, HIPAA compliance involves the following key areas. Patient confidentiality. Pharmacies must ensure that all patient health information, including prescription records, is kept confidential. This applies to both electronic and paper records. Electronic health records are. Pharmacies must use secure systems to store and transmit electronic health records. This includes encryption, access controls, and audit trails to monitor who accesses the information. Paper records. Paper records containing PHI must be stored securely, such as in locked filing cabinets, and access must be restricted to authorized personnel only. Patient access to records. Under HIPAA, patients have the right to access their health records and request corrections if necessary. Penalties for non-compliance. Penalties for non-compliance can range from civil fines to criminal charges, depending on the severity of the violation. Fines can be as high as $50,000 per violation, with a maximum annual penalty of $1.5 million. A pharmacy technician, Emily, notices that the records for Schedule I controlled substances are missing for a recent inventory check. She informs the pharmacist, Mr. Collins, who realizes that the last several transactions have not been properly logged. What actions should Mr. Collins take to rectify their situation and comply with DEA record-keeping requirements? Answer. Mr. Collins must take immediate steps to rectify the missing records. Inventory reconciliation. Mr. Collins should perform an immediate inventory check of all Schedule I substances to determine the extent of the discrepancy. DEA regulations require that accurate records be maintained for all controlled substances, especially Schedule I drugs. 21 CFR SS.11. Log update. He should update the prescription log with any missing entries, ensuring that all Schedule I transactions are recorded separately from other schedules and are easily retrievable. DEA notification. If there are significant discrepancies or suspected theft, Mr. Collins must complete DEA Form 106 to report the loss or theft within 1 business day. Audit trail. Maintaining a robust audit trail helps ensure compliance and can be crucial in case of an inspection. The DEA requires pharmacies to keep records for at least 2 years. Corrective measures. Mr. Collins should implement corrective measures, such as retraining staff on proper record-keeping procedures or enhancing security measures to prevent future issues. What are the key components of compassionate use and expanded access programs under FDA regulations, and how do they facilitate patient access to investigational drugs? Answer. Compassionate use and expanded access programs allow patients with serious or life-threatening conditions to access investigational drugs outside of clinical trials. The key components include eligibility criteria. Patients must have a serious or life-threatening condition for which no satisfactory alternative treatment is available. They must be unable to participate in a clinical trial for various reasons, such as exclusion criteria or logistical challenges. Physician involvement. A licensed healthcare provider must submit a request on behalf of the patient to the drug manufacturer for access to the investigational product. The physician must provide detailed information about the patient's condition and the rationale for the request. FDA requirements. The FDA requires manufacturers to provide a treatment protocol, and patients must give informed consent before receiving the investigational drug. The manufacturer must maintain records of the use of the drug under the program and report adverse events to the FDA. Manufacturer discretion. Participation in compassionate use is at the discretion of the drug manufacturer, which may choose to limit the number of patients or require specific conditions for use. Regulatory compliance. Both the physician and manufacturer must comply with applicable regulations, including reporting requirements for adverse events to the FDA. These programs ensure that patients with no viable treatment options can access potentially life-saving therapies while maintaining patient safety and regulatory oversight. What are the essential principles outlined in the Code of Ethics for Pharmacists, and how do they guide pharmacists in their professional conduct? Answer. The Code of Ethics for Pharmacists provides a framework for professional behavior, guiding pharmacists in their practice. The essential principles include patient care and welfare. Pharmacists must prioritize the health and well-being of patients, ensuring that their actions promote patient safety and improve health outcomes. Professional competence. Pharmacists are expected to maintain their knowledge and skills through continuous education and training to provide high-quality care. Respect for patients' rights. Pharmacists must respect patients' rights to autonomy, privacy, and confidentiality. This includes obtaining informed consent before providing services. Integrity and honesty. Pharmacists should act with integrity, avoiding conflicts of interest and ensuring that their actions are transparent and honest. Collaboration. Pharmacists should work collaboratively with healthcare professionals to optimize patient care, ensuring that all members of the healthcare team communicate effectively. Social responsibility. Pharmacists are expected to contribute to public health, including participation in health promotion activities and addressing societal health needs. MS. Taylor, a pharmacist, has been offered a significant gift by a pharmaceutical representative from a company whose products she frequently prescribes to patients. The gift includes an all-expenses-paid trip to a conference. How should MS. Taylor approach this situation, considering the ethical guidelines and potential conflicts of interest? Answer: MS. Taylor must navigate this situation carefully to maintain ethical standards in pharmacy practice. Understanding conflict of interest. A conflict of interest occurs when a pharmacist's personal interests could improperly influence their professional judgment. Accepting gifts or inducements can compromise the objectivity expected in patient care. Consulting the Code of Ethics. The Code of Ethics for Pharmacists emphasizes that pharmacists should avoid situations that may lead to conflicts of interest and should not accept gifts that could influence their professional decisions. Transparency and disclosure. MS. Taylor should disclose the offer to her pharmacy management or compliance officer, as transparency is essential in maintaining professional integrity. Refusal of the gift. It is advisable for MS. Taylor to decline the trip and any other gifts that may appear to influence her professional decisions. This helps maintain the trust of her patients and the integrity of the pharmacy profession. Documentation. Documenting the situation can be beneficial in case any questions arise in the future regarding her professional conduct. What security measures must pharmacies implement to comply with DEA regulations regarding the storage and handling of controlled substances? Answer: pharmacies are required to implement stringent security measures to ensure the safe handling and storage of controlled substances as mandated by the DEA. Key requirements include physical security measures. Controlled substances must be stored in a securely locked cabinet or safe. Schedule I substances should be stored separately from other medications to prevent unauthorized access. Alarm systems. Pharmacies should have alarm systems that detect unauthorized access to areas where controlled substances are stored. Access control. Access to areas where controlled substances are stored should be limited to authorized personnel only. This includes implementing key control systems and requiring employee identification for access. Employee screening. Pharmacies must conduct thorough background checks on employees who will handle controlled substances. Reporting theft or loss. In the event of a theft or significant loss of controlled substances, the pharmacy must report the incident to the DEA using DEA Form 106 within 1 business day. What is the proper procedure for pharmacists to follow when addressing client complaints, and why is effective complaint resolution important in maintaining professional standards? Answer: pharmacists must have a structured approach to handling client complaints to ensure effective resolution and maintain professional standards. The procedure includes initial response. Pharmacists should acknowledge the complaint, promptly listening to the client without interruption to understand their concerns fully. Documentation. All complaints should be documented accurately, including the details of the complaint, the date received, and any relevant background information. This documentation is crucial for tracking patterns and improving services. Investigation. Pharmacists should investigate the complaint thoroughly. This may involve reviewing patient records, consulting with staff involved, and analyzing the situation to understand the root cause of the complaint. Resolution pathways. After investigation, pharmacists should propose a resolution to the client. This may include a correction of the error, an explanation, or an apology if warranted. Ensuring the client feels heard and valued is essential. Follow-up. Following resolution, pharmacists should follow up with the client to ensure their satisfaction with the outcome and to demonstrate that their feedback is valued. Continuous improvement. Complaints should be used as learning opportunities to enhance services and prevent future issues. This aligns with the ethical principle of continuous improvement in patient care. Effective complaint resolution is vital in maintaining trust and credibility in the pharmacy profession. It demonstrates a commitment to patient care and adherence to professional standards, fostering positive relationships with clients and improving overall service quality. What is the primary purpose of background checks in the licensure process of pharmacists, and what types of information might lead to a denial of licensure? Answer: the primary purpose of background checks in the licensure process of pharmacists is to ensure the integrity and safety of the healthcare system by evaluating an individual's criminal and professional history. This helps to protect public health by identifying individuals who may have engaged in behavior that could pose a risk to patients. Types of information that could lead to a denial of licensure include convictions for drug-related offenses, fraud, or other crimes involving moral turpitude, unprofessional conduct, or falsification of application materials. Each state board may have different criteria for what is considered disqualifying, but typically the emphasis is on conduct that demonstrates a lack of trustworthiness, honesty, or fitness to perform the responsibilities of a pharmacist. Relevant law. State Pharmacy Act provisions regarding licensure typically outline these requirements and stipulate that individuals must disclose criminal history as part of their application. For example, a pharmacist with a felony conviction involving controlled substances may be subject to permanent exclusion from licensure under 21 U.S.C. SS 824 Controlled Substances Act. Under what conditions can a pharmacist's license be suspended or revoked, and what due process rights do pharmacists have during disciplinary proceedings? Answer: a pharmacist's license can be suspended or revoked for a variety of reasons, including but not limited to negligence, fraud, violating pharmacy regulations, practicing under the influence of drugs or alcohol, or dispensing controlled substances improperly. Additionally, failure to maintain proper records, violating patient privacy, and engaging in unprofessional conduct are grounds for disciplinary actions. Pharmacists are entitled to due process rights, which means they must be given notice of the charges against them and an opportunity for a hearing to present evidence and challenge the charges. Most state boards of pharmacy follow the guidelines established under Administrative Procedure Acts of Power, which ensure fair administrative processes. In some cases, pharmacists may also appeal decisions made by the board to a higher court if they believe the process was unjust. Dr. Smith and pharmacist Melissa have entered into a collaborative practice agreement (EPA), allowing Melissa to adjust medications for patients with chronic conditions, such as hypertension. One day, a patient under this agreement asks Melissa to prescribe an antibiotic for an unrelated infection. What should Melissa do in this situation? Answer: in this scenario, Melissa is operating under a collaborative practice agreement (EPA) that likely limits her authority to adjust or manage medications for specific chronic conditions, such as hypertension. Unless the CPA specifically grants her the authority to prescribe antibiotics for infections, Melissa is not permitted to do so. She should refer the patient back to Dr. Smith or another authorized prescriber for the treatment of the infection. CP has typically outlined the scope of practice, including the specific diseases or conditions the pharmacist is authorized to manage and the types of medications they can prescribe or adjust. Melissa must adhere strictly to the conditions outlined in the CPA to avoid practicing outside of her authorized scope, which could lead to disciplinary action by the State Board of Pharmacy. Relevant law. State Pharmacy Practice Act provisions on CP as often regulate the scope and limitations of pharmacist prescribing authority, which must be followed strictly to remain compliant with state law. What is the role of Prescription Drug Monitoring Program (EDMPS) in controlling opioid prescriptions, and how do they help prevent opioid abuse? Answer: Prescription Drug Monitoring Program (EDMPS) are state-run electronic databases that track prescriptions for controlled substances, including opioids. Their primary role is to help prevent prescription drug abuse and diversion by providing pharmacists and healthcare providers with critical information about a patient's controlled substance prescription history. This allows prescribers to identify potential red flags such as doctor shopping when a patient seeks prescriptions from multiple providers or overuse of opioids. Pharmacists are often required to check the PDMP before dispensing controlled substances to ensure that the prescription is appropriate and that the patient is not receiving an unsafe quantity of opioids. PDMPS also assist in identifying trends in prescription drug use, providing valuable data to regulators and law enforcement agencies. By monitoring opioid prescriptions, PDMPS help healthcare providers make informed decisions and reduce the risk of opioid abuse and overdose. Relevant law. Comprehensive Addiction and Recovery Act, CARA of 2016, which encourages the use of PDMPS to monitor opioid prescriptions, and state-specific regulations that mandate PDMP participation. In most states, are there any restrictions on who can own a pharmacy? What are the key factors that boards of pharmacy typically consider when issuing pharmacy permits? Answer: yes, most states impose restrictions on who can own a pharmacy to ensure that the ownership structure promotes safe and effective pharmacy operations. While it is common for licensed pharmacists to own pharmacies, some states allow non-pharmacist ownership as long as certain conditions are met. Boards of pharmacy generally require that a licensed pharmacist be actively involved in the day-to-day operations or management of the pharmacy to ensure compliance with state regulations and standards of practice. Key factors that boards of pharmacy consider when issuing pharmacy permits include whether the owners or officers have any criminal history or past disciplinary actions that might affect their ability to operate, The pharmacy safely. The presence of a pharmacist in charge, PIC, who is responsible for the pharmacy's compliance with laws and regulations. The physical setup of the pharmacy, including security measures for storing controlled substances. The ability of the pharmacy to maintain proper records and ensure safe dispensing practices. What are the certification and continuing education requirements for pharmacy technicians in states where certification is mandated? Answer: in states that mandate certification for pharmacy technicians, individuals must typically pass a national certification exam such as the Pharmacy Technician Certification Exam (PE), offered by the Pharmacy Technician Certification Board (PC), or an equivalent exam. Certification ensures that technicians have the necessary knowledge and skills to perform their duties safely and effectively under the supervision of a licensed pharmacist. In addition to initial certification, most states require pharmacy technicians to complete continuing education to maintain their certification. Requirements usually focus on topics such as medication safety, law updates, and advancements in pharmacy practice. Technicians may need to complete a specific number of CE hours, such as 20 hours every 2 years, with some hours dedicated to law or medication safety. Relevant law. State Pharmacy Acts typically outline the requirements for pharmacy technician certification and CE, ensuring that technicians stay current with evolving pharmacy practices and legal standards. How do state-specific limits on prescribing controlled substances, such as opioids, impact pharmacists' responsibilities when filling prescriptions? Answer: state-specific limits on prescribing controlled substances, particularly opioids, have been implemented to address the opioid epidemic and reduce the risk of abuse and addiction. These limits may include restrictions on the quantity of opioids that can be prescribed, such as a 7-day supply for acute pain, as well as specific dosage thresholds. Pharmacists play a critical role in enforcing these limits by ensuring that prescriptions they receive comply with state regulations. Before dispensing, pharmacists must verify that the prescription meets the state's requirements regarding dosage and duration. They must also consult the Prescription Drug Monitoring Program (PDMP) to check the patient's prescription history, ensuring that the patient is not exceeding the allowed limits or exhibiting signs of opioid misuse. Pharmacists who dispense opioids without adhering to state-specific limits could face disciplinary action from the State Board of Pharmacy or even criminal charges for contributing to opioid misuse. Relevant law. State Controlled Substances Act and Federal Controlled Substances Act 21 U.S.C. SS 801, which govern the prescribing and dispensing of controlled substances, including opioids. What are the key requirements for the proper storage and handling of controlled substances in a pharmacy, and how do these requirements help prevent diversion? Answer: the proper storage and handling of controlled substances in a pharmacy are critical to preventing diversion and ensuring patient safety. Key requirements include securing controlled substances in a locked and secured area such as a safe or vault that is only accessible to authorized personnel, maintaining accurate and up-to-date inventory records of all controlled substances, including quantities received, dispensed, and remaining, conducting regular audits and reconciliations to ensure that the inventory matches the records and to quickly detect any discrepancies or losses, temperature and environmental controls to ensure that medications are stored under appropriate conditions to maintain their efficacy and safety. These requirements help prevent diversion by limiting access to controlled substances and ensuring that any theft or loss is quickly identified and reported. Failure to comply with these storage and handling protocols can result in significant penalties, including fines, license suspension, or criminal charges. What are the key regulatory requirements for compounding sterile preparations in a pharmacy, and how do these requirements ensure patient safety? Answer: the compounding of sterile preparations in a pharmacy is subject to strict regulatory requirements to ensure patient safety and the integrity of the compounded products. Key requirements include facility standards. Pharmacies must maintain clean rooms or designated compounding areas that meet specific environmental controls, including air quality, HEPA filtration, temperature, and humidity to minimize contamination risks. Personnel training. Pharmacists and technicians involved in compounding must receive specialized training in sterile compounding techniques, aseptic practices, and infection control measures to ensure that they are qualified to perform these procedures. Equipment validation. All equipment used in the compounding process must be regularly cleaned, maintained, and calibrated to ensure proper functioning. This includes autoclaves, laminar flow hoods, and other critical tools. Standard operating procedures (SOPs). Pharmacies must develop and follow written SOPs for compounding sterile preparations, including detailed instructions on techniques, ingredient sourcing, and quality control measures. Quality assurance testing. Compounded sterile products must undergo rigorous testing for sterility, potency, and stability, including appropriate labeling and expiration dating to ensure safety and efficacy. These requirements help prevent contamination, ensure the accuracy of compounded medications, and safeguard patient health. Non-compliance can lead to severe consequences, including patient harm, legal repercussions, and loss of pharmacy licensure. Relevant law. United States Pharmacopeia chapter, which sets forth standards for compounding sterile preparations, along with state pharmacy regulations. What are the main legal and ethical considerations pharmacists must adhere to when advertising and promoting pharmacy services? Answer: when advertising and promoting pharmacy services, pharmacists must navigate several legal and ethical considerations to ensure compliance and maintain public trust. Key considerations include truthfulness and accuracy. Advertisements must be truthful and not misleading, providing accurate information about the services offered, including pricing, availability, and any qualifications. Regulatory compliance. Pharmacists must adhere to state and federal regulations governing advertising, such as the Federal Trade Commission (FTC) guidelines and state pharmacy board rules, which may impose restrictions on advertising controlled substances or prescription medications. Avoiding false claims. Pharmacists must avoid making unfounded claims about the efficacy of medications, treatments, or services, which could mislead consumers or lead to legal repercussions. Confidentiality. All promotional materials must respect patient confidentiality and privacy rights, ensuring that no identifiable patient information is disclosed without consent. Professional standards. Advertisements should reflect the professionalism of the pharmacy practice and should not diminish the reputation of the profession. Pharmacists should avoid using sensationalism or emotional appeals to attract clients. By adhering to these legal and ethical standards, pharmacists can promote their services responsibly while fostering trust and credibility within the community. Relevant law. State Pharmacy Practice Acts and FTC guidelines on advertising, which govern the promotional activities of pharmacies.